Hello, I'm Ivakshi, and today I'll be presenting work on overcoming interpretability and accuracy trade-off in medical imaging. This is joint work with Samira Ibrahimi Kaho, and we are based in MILA and ETS. So, with the growing use of machine learning models in healthcare, it has become very important to understand the behaviors of these machine learning models beyond just final predictions and final accuracy. We would like to reason why a model predicts a certain class in, for example, classification. In medical imaging, radiologists and pathologists are assisted by machine learning models to help make a certain decision. Now, imagine if there was just a medical professional who would look at this image and they would introduce or be able to recognize some patterns in the image. These patterns include either ulcer, fribble, no patches present, and this helps them predict that the image present is a benign image. Now, given how opaque these models are, how do we make a machine learning or a neural network reason the way humans reason? One way to do that is to introduce concept bottleneck models. In essence, what concept bottleneck model does is it predicts a high-level human understandable concepts which are trained in supervised fashion from a given image. So over here, we can see that the image gives different concepts as predictions, either fribble, plaque, yes or no. So these are binary concepts that are present. Now, the final task is still classification. So one way to introduce the classification task is to go from concepts to the final class. So essentially, we're going from X to C, which are human understandable concepts, to Y. Let's look at how do we train these models. So we're essentially training concept predictor, since it's a supervised task, concept predictor and label predictor simultaneously. Once we train these models, we now observe and compare the performance of CBMs compared to standard models. Standard models are those which do not have concepts present. So let's say off-the-shelf ResNet trained on the data set, and this data set is predicting 13 different TIL slides and cancer types. So here we observe that standard models do perform much better than CBM concept-based models. This poor performance, in essence, gives us unfortunate interpretability and accuracy trade-off. CBMs are, in essence, interpretable and explainable, but they have poor performance. This is the motivation of our work, and we propose co-op CBM that overcomes this trade-off. So over here, let's imagine we have the normal CBM stream, but we introduce an auxiliary stream where the model predicts an auxiliary label to make the concept predictor understand a bit more about the final label. So in essence, h of x is encoding for the residual of the label information that is absent in g of x. When we look at the performance, we observe that co-op CBM not only does better than standard models, but also does much better than any other CBM models. We also perform interventions on TIL dataset, and we observe that co-op CBM is the most receptive to interventions. So in essence, we proposed a new model, co-op CBM, to be able to overcome interpretability and accuracy trade-off. Feel free to reach me out for any discussions or chat about the work. We'll be happy to help. Thank you.